Hello, everyone. I hope you are all having a great day, whether it's a morning, afternoon, or evening. Thanks for joining today, our webinar. This is the second webinar on extreme heat research. If you haven't had a chance to join the first one, and if you'd like to watch the recording, I will put the link in the chat and you can check it out. Before going further, I would like to start by introducing myself. So my name is Aynur Kadı Hasanoğlu, and I work at the Red Cross Red Crescent Climate Center and the Global Disaster Preparedness Center. Both of them are reference centers of International Federation of Red Cross Red Crescent. And today I have my colleague Matt Greek from American Red Cross to help us with the presentations. And I am very, very happy to introduce you the four of the researchers that join us today. You will hear from them very soon, but let me just give you very quickly who they are. We have Dr. P.K. Latha. She is a research associate at Sri Ramachandra Institute of Higher Education and Research in India. We have Victor Mogre from Ghana, University of Development Studies, Tamale. And we also have the pleasure of having Dr. Patience Chadambuka. She's a lecturer in the Community Studies Department at the Midlands State University, Zimbabwe. And we also have Dr. Edgar Miguel Alvarez and Gabriel Mijanos. They are from the Health Sciences School of University of Rafael Landivar from Guatemala. Welcome, welcome, and you will have a chance to maybe say a few more words about you and your team when presenting your research. I would like to give a very, very brief overview of this research program before we move to the first presenter. Matt, can we start the presentation? Thanks. And while waiting for that, may I just remind you that you are muted, but please feel free to put your questions in the chat. Towards the end, we are hoping to have at least 10, 15, maybe 20 minutes for questions and answers. So I will try to keep an eye on the questions. So we started this extreme heat research in low and middle income countries last year, December, and we announced that it was an open call for researchers. And we received 80 applications. Next slide, Matt, please, from different countries. And this research program aimed to increase knowledge on heat waves and extreme heat events and their impact on people, which is probably many of you are very well aware that there's a huge knowledge gap about risk perceptions, local heat thresholds and triggers, public perceptions towards extreme heat, but also lack of knowledge and practice in terms of which strategies work best to address the extreme heat impacts and to influence policy and action. So that this research program aimed to find some answers from different countries, different communities on different topics. So today we are going to hear from researchers. So actually, all of them worked on the topic 2, public perceptions, risk perceptions towards heat, but they all worked in different contexts and with different community groups. With that, I would like to invite PK Latha to start her presentations. PK, floor is yours. This is a distribution of countries where the research took place. In 13 countries, 15 researchers. And I will put, as I said, in the link at the chat, and you can have a look later. Okay, floor is yours, PK.
Thank you, Anu.
Matt, we can skip these. It's okay.
Thank you, Anu. Am I audible?
Are we able to?
Yes,
Okay.
yes, and I will.
Next one,
Am I
please.
audible? Hello.
Are we good?
The first slide, Anya. Previous slide.
Can we go to the first slide, please, Matt?
Shall I start, Anya? Can it be
Yes,
started?
please, go ahead. Please go ahead.
Good evening, everyone. Today, thank you, Anu, for a brief introduction of myself. As I said, I am Lata from Sri Ramachandra Institute of Higher Education Research from India. Coming to my research topic is on heat, heavy workload, dehydration, and actually my presentation is not seen, Anu.
Maybe it is coming, I think. Do we have a problem, Matt?
Dehydration as a risk factor for poor renal health. What do the workers think? So this main research is mainly focused upon what is it, how the heat is a factor, or what is the workers' awareness, especially on heat as a factor for incidence of renal illness. So this is the speciality and the novelty of the present study. So the purpose of the study is to determine what is the exact knowledge and what is the belief that the workers have, especially on heat, dehydration, and excessive workload as a poor, and also the poor sanitation is also considered as one of the risk factors for incidence of CKD. So this was the main aim upon which the study was done. And with this aim, the study was conducted in three objectives. First was to obtain the workers' knowledge and awareness, especially upon the heat-related illnesses, what is they perceive, and then the heat, and what is their knowledge and awareness on heat, poor hydration, and poor sanitation and workload as a renal illness. And then also, not only the study stopped with this, but it was also able to wanted to identify what is the identity, like what is their attitude towards the coping mechanisms, like what personal feelings they do, what nutrition intake they do, and what impact that this have on their health. So this was the objective. And then the next objective was to find an association with the gender, age, work category, as well as the years of employment. And the third was to find out and group recommendation for them based upon the perception. And the entire study, you can see the research team on the right hand side. Our research team consists of 4 persons, like including me and junior industrial hygienist and junior research fellow were involved in the study. Next slide, please. Coming to the context of the study, based upon the objectives, the study was done in 4 districts of Tamil Nadu, that is Tiruvallur, Kanchipuram, Chengalpattu, and Chennai. As you can see from the image of the below, the 4 districts were covered in the study. And the study was done in 4 outdoor workplaces, especially in brick manufacturing, agriculture, Mahatma Gandhi rural workers, and construction workplace. So from these 4 workplaces, the study participants was 418 workers were recruited for the present study. And as you can see from the table, equal number of men and women, like women workers were more when compared to the men workers. And the age factor was equal number of age, like less than 41 with equal number of 50% of the workers were there in that cases. And if you see also, more than 3 years of exposure was higher among the female workers when compared to the male workers. And also, it's the blue highlighted one. You can see the workers were doing heavy workload. Male workers were doing heavy workload when compared to the female workload. So this is a characteristic of the participants who were selected for the present study. Next slide, please. Now coming to the how did the research go about? What are the assumptions and expectations? This study is purely an perception-based study. So we felt that the male workers would be more aware of the heat-related illnesses and also the participation would be better. But unlikely of that, it was found that the female workers were more aware about the heat-related illnesses and they were the persons who were more interested and they really, really wanted to participate in the study. So this is the unexpected thing that was happening in the present study. Now coming to the process and methodology, how the study was done. Initially, screening of the participants was done. Like not all the participants were included in the study. They were screened for based upon their few inclusion and exclusion criteria. Then based upon the screening validated, that is internationally validated FONTEPS questionnaire was used to obtain the perception of the workers upon their heat-related illnesses and other objectives that I mentioned in the previous slide. And all the data were based upon the Likert scale was used to the for capturing the workers' data. And all the data were analyzed in an SPSS software using a magnetic test, and mostly chi-square test was used in the study. Now coming to the challenges faced, yes, it is purely an subjective based study. There were really many challenges we faced in the study, like obtaining permission from the owners of the occupation sector was the biggest challenge, because the questionnaire administered took about 15 to 20 minutes, which will take away the workers' time. So they have to compensate for the money for which the worker is losing that particular time. So it was the biggest challenge for me for conducting while going into the field. And also the willingness of the workers to participate in the study was the greatest challenge, because same way as I said, the time duration in which they are engaged in the research question along with us, they have to compensate for that, or the workers had to be paid for that particular time. So this was a challenge especially. And how did I overcome is that this is a solution, like the day before the study of those conducted, we went in person and we started to sensitize the workers about why we conduct the study, what is the importance of conducting the study through videos, through pamphlets, and also even through conducted several presentations to the workers, then which in their local language, which made them understand why it is important to the study. So these were the challenges, and these were the solutions which were applied in order to overcome these challenges. And the next slide. Yeah, so these are the key findings of the study, where the entire study was divided into two sections. One is the exposure, that is heat to which the workers were exposed, and then the perception. The exposure showed that more than 95% of the workers were observed to be working above the safe limit with an average exposure WHD, which means that if they expose 95%, almost nearly 100% of the workers are perceived to be working above the safe limit. And the perception results showed that 86%, like out of irrespective of the gender, 86% of them perceived heat-related illnesses, and also urogenital symptoms are perceived by 69% of the workers. And similar findings have been already reported by Lee et al. In 2020. And if you see the workers' awareness on the hydration, heat, and poor sanitation and physical load, the percentages you can see were very minimal, which like 18, 25, 17, and 9, which means that the perception, the workers' knowledge, especially upon these factors as a risk factor, is very less. That was the research as shown in the result. Similarly, for the coping strategies also, only few coping strategies the workers were aware, and they were not aware of almost many other few other things that are present. Same way in case of traditional nutrition also, only 3 to 4 like tender coconut, buttermilk, ragi, and fruit and lemon, the people were aware. More than 95% of the 90 to 90, 80 to 90, 95% of the workers were aware of these traditional intakes also. Statistically also, we could find a significant association between the workers, especially if we could find in case of if you see HRI, there was a significant association with the workers' perception on heat-related illnesses and the gender. And if you see, the risk was very high for the female workers when compared to the male workers. This is a key finding from the study. Same way, the coping mechanism also, taking shower had a significant association with the gender, years of exposure, work category, and in these cases also, the female workers were having the highest level of risk factors when compared to the male worker. And the same way, in case of nutrition also, the female workers were having the higher level of risk when compared to the male workers. So this is a key finding from the study. In traditional intake, we can see the workload had a significant association, especially with the cucumber, buttermilk, ragi, and tender coconut, irrespective of all the other nutrition factors that are also available. So these are the key findings which showed that the workers are really exposed to very high heat, especially during the 6 months. Next slide. So what is I conclude is that the workers should have a proper water intake of water, or any nutrition intake should be there. and providing them rest and shade properly at a specific time and duration will really focus on this. Working efficiently with efficient tools will also enable the workers to get less amount of impact of heat, and intake of relevant coolant like food diet includes which are coolant diets like buttermilk, ragi, etc. will definitely reduce their impact of heat stress on them when they are going to really work on the outdoors. So this is a recommendation that I have suggested to the workers. And to conclude my study, it was as said the hypothesis, we can see the Indian workers have poor knowledge and awareness of heat as a major risk factor for kidney-related illnesses. And female workers were much more aware when compared to the male workers. This is a key finding. And also their acceptance was also very high among the female workers when compared to the male workers, and their acceptance of heat, heavy workload, poor sanitation, and hydration as a risk factor for HRA and kidney-related illnesses is very minimal. And it this definitely we found these factors varied with the gender, age, and also duration of exposure to which they work in the same field. So this is the conclusion of the present study. Thank you.
Thank you so much, PK. For sharing your research. It's really interesting results. And this is one of the researchers who really showcased the gender differences in this perception. And I found it extremely interesting. And it's really very different. Thanks for that focus. And I think the focus on outdoor workers, workplaces, especially in urban settings, and as well as agricultural, but especially in urban setting, this is a major problem. And we'll hear more about this kind of research focusing on outdoor workers, different types of workplaces from in other researchers as well. But thank you very much. Again, a quick reminder to put your questions in the chat. So we'll get back to you, PK. Now, I would like to move to Victor, who is going to walk us through the research in Ghana about public perceptions of health and social risk of extreme heat. So I guess Matt is going to share this presentation right now. Okay. Victor, the floor is yours.
Thank you. We looked at public perceptions of extreme heat, and with regards to social risks of extreme heat in northern Ghana. Ghana is a country found in West Africa, and this particular study was done in the northern part of Ghana, which is usually experiencing a lot of heat throughout the year. We only have one rainy season, and the rest of the year is always dry season. Currently, we are in that time of the year whereby the temperatures can actually rise as high as 40 degrees Celsius. So that shows how much heat that we are experiencing. The time we conducted this study was a time that we were transitioning from kind of the rainy season into the into the heat season. Can we move to the next slide? Yes, so we conducted this study. As I said, it's a qualitative study that we conducted, and we are a team of researchers comprising people from New York University and then University for Development Studies, as you can see in the team on the slide. We can move to the next slide. Yeah, so the purpose of the study was for us to explore public perceptions of the health and social risks of extreme heat in northern Ghana. We were of the theory that if people perceive extreme heat to be a risk, they are more likely to take certain mitigating measures so that they can be able to reduce the effect of extreme heat. But as we'll find out later on, we'll know that it is not only perceptions that would influence the mitigation factor, but there are other issues that would also influence it. Let's move to the next step, the next slide. Hello.
Maybe the next one, you mean? Okay.
Yes, the next slide.
This is the one?
No, not this one. Then, yes, this one. Yes,
Okay.
so with regards to the setting, as I indicated, this particular study was conducted in the northern part of Ghana that have huge disparities with the southern part of Ghana when it comes to food insecurity. I don't know, there should be a slide before this. Yes. So as I indicated, this particular study was conducted in the northern part of Ghana, which is located about 500 kilometers from the from Accra, which is the capital city of Ghana. Tamale is a cosmopolitan city. It's the fastest growing city in West Africa. There are over 700,000 inhabitants in Tamale, people from different settings, although the Dagbani ethnic group is the most predominant one in the setting. It's largely urban with a bit of rural settlements. As I've indicated, at this time of the year, our temperatures are rising up to 40 degrees Celsius, indicating that we are in the heat season. Yeah, we can move to the next slide. And the northern region, where Tamale is located, have got huge disparities when it comes to the situation of food insecurity as compared to other parts of the country. As you can see on the map on your left-hand side, you see that the northern part of Ghana is where you have the red zones with regards to food insecurity. That has high levels of food insecurity as well as nutrition insecurity. So this is a setting that has high levels of this with regards to high household size and all of that. So that is the setting in which we conducted this study. Now move to the next slide. Yes, so we adopted a qualitative approach to be able to understand the perceptions of rural people as well as urban people with regards to how they perceive heat, how they and how they are also able to mitigate heat, and how it also affects their uh, livelihoods. And we actually recruited 28 participants, that's 16 women and 12 men. We had a number of focus group discussions, 4 of them, and then as well as 12 key informant interviews. We analyzed the data in vivo. We adopted the process of coding, whereby 2 independent members coded the individual transcripts, and then later on they compared their findings, and then we discussed to resolve differences. Then at the end, we generated teams, and we'll report the findings here according to the teams that were generated from the analysis. Let's move to the next slide. Yes, with regards to the challenges that we face in the field, as you are aware, we were actually delayed with ethical clearance. We got the clearance at the last minute, which we had to conduct this study within a short period of time, in a period of about 1.5 months, and that was a lot to do because of the ethical clearance. So those were the challenges that we had. Another issue that we had when we were conducting the data had to do with the fact that because Tamale is a cosmopolitan city, you have different languages and different dialects. So we had 1 or 2 issues, and we had to, at some point, engage translators to be able to support in this process. And because of the language differences, it resulted in our focus group discussion becoming a bit lengthy and taking a bit of time. That also affected the amount of time that the people had for the discussions, to the extent that at some points you have to break the focus group sessions to enable people to be able to go and pray. You know, Tamale is a predominantly Muslim community, so which engage in at least 5 prayers in a day, and there were some times that the timing of the data actually affected the time at which they were supposed to go for prayers. But these are lessons that we have learned, that when we are going to design future studies, we will know how to model the data collection in such a way that we can be able to incorporate some of these challenges that we face in the field. We can move to the next slide. Yes, so as I indicated earlier on, we looked at, we analyzed, we used code to analyze the data, which at the end we generated teams. And one of the themes that came out was with regard to the perception of extreme heat on health, that almost all the people that we interviewed identified that extreme heat have got an effect on their health. It can increase the risk of certain diseases, for example, cerebrospinal meningitis, which is actually endemic in the northern region. And normally during the heat period, you have this, increase in the number of cases of CSM, the skin rashes. Some of them even indicated that when they begin to see skin rashes on children's body, all of that, that is what they are able to determine that the heat season is actually coming in. And sometimes because of the fact that they have to also struggle to be able to sleep at night because of the heat, they have situations of sleep apnea and all of that. During that period too, there's also increased hospital visits as well as healthcare costs, that there's also increase in the prevalence of malaria and other disease conditions. It also has impact on non-communicable diseases. I think one of the participants indicated that, for example, if somebody who's managing hypertension, that who requires that, oh, maybe in the evening he should be able to rest, he should be able to relax. You know, sleep is actually one of the self-care activities that is required in the management of non-communicable disease. But this is a situation whereby at night or during the daytime, the person is not able to rest because of the heat, which is causing them to sweat a lot and all of that. So you have people always finding themselves in a situation of helplessness and uncertainty, in the sense that if at night they find it difficult to sleep, and they cannot also be able to actually come out and sleep outdoors, because they also increase the risk of getting mosquito bites that can increase their risk of getting malaria. So there's always that situation of helplessness and uncertainty that you have with people, as depicted in this quote here by a 70-year-old trader who says, you don't know what to do with your body, because today there is heat, tomorrow there will be cold. Nowadays, they put off the lights almost all the time. If you are to sleep outside, the mosquitoes are biting, which actually causes malaria. Tamale too, or in northern Ghana, we normally experiences issues of frequent power shortages. That in the sense that you are not able to actually put on your fans or air conditioners that can be able to cool the environment for you. So all of these things come into play, and people are actually experiencing effects of extreme heat. Now move to the next slide. Yes. Then we also looked at the housing and ventilation. As I said, a lot of the people were aware of the effects of extreme heat, the perceptions of extreme heat and on them, but there were instances of people not actually applying those mitigation measures, or not applying those perceptions into the design of the buildings. So as you can see in the pictures, we identified a number of rooms that had smaller windows that didn't actually allow ventilation. And all of that, it is not that they are not aware, but sometimes it has to do with economic situations. And sometimes they also cover the windows, especially during the rainy seasons that are always windy, that are always bringing in a lot of water into the room. So they try to cover this. But the obvious thing is that during the dry season, some of these window coverings should actually be removed, but you have a situation of the people still keeping them, and that has an effect as to how they are able to handle them. As you can see there, because of the fact that—
Sorry, Victor, can we wrap up, please? Because we need
Yes.
time for other presenters too. Sorry
All right,
for
we'll
cutting
do
you.
that. I think the break in transmission of changing the slides, but let's go on. So you have most of the poor people actually becoming more vulnerable. And as I indicated earlier on, when people try to sleep outside, you see them having the risk of all of that. It also has an impact on their livelihood. I think I've identified some of them earlier on about the fact that the health season, you have an effect on the on the land. You have the land drying, which doesn't allow for farming. You have the occurrence of bushfires. Bushfires. Sometimes you have a situation of people harvest being burned as a result of the bushfires, because during that period you have an increased risk of bushfires actually occurring. You have poor crop yield and all of that, which also at the end actually aggravates the food and nutrition insecurity situation that is already endemic in the northern part of Ghana. During the heat season too, there's also an intensified water crisis. There's already a water crisis in northern Ghana or in Tamale, but during the heat season, people who have had access to other sources of water, let's say coming from the rain, water, all of that, is no longer available. And they have to rely on the few that are available. And as a result of that, it increases or it intensifies the water situation and even increase the risk of water-related diseases. Let's move to the next slide. Yes, so as you can see, one of the what do you call it? One of the research participants indicated the sort of challenges that they have, in the sense that during the dry season, all the dams and what that they can be able to rely on to be able to get water get dried up. And as a result of that, they always find themselves in a sort of a helpless situation. Let's move to the next slide. Yes, so based on the findings, we have actually come up with the following recommendations: that there's a need for a collaborative public health intervention that is involving town and country planning, forestry commission, all the agencies, all the main stakeholders, because of the fact that the issues of health, the issue of heat, all of that involves several sectors in the economy, or it involves several sectors that will have to come into play to be able to come up with an integrated intervention that will be able to increase knowledge and awareness of risk factors and also increase people's understanding of the coping strategies. There's a need to improve access to affordable mitigation methods. As we indicated, the awareness is there, but the fact is that people do not have access to affordable mitigation measures. It's not everybody who can be able to, to afford an air conditioner. There are some families, they will not be able to even afford funds that will be able to provide them with, opportunity to be able to cool their rooms for them. Then there's also the need.
Thank you, Victor.
Provide treatment
Really,
on
shall we just, we need to wrap up really.
Yes,
yeah,
so
please.
I'm done.
Okay.
Just improve coordination among all the sectors and the partners. And the fact that there's also the need to increase funding for a lot of African countries, because there is little research in that area, and that funding can increase the research with regards to climate change and its effects on health. Yeah. So I will thank you so much.
Thank you so much. Thank you so much for sharing this very interesting research, and thank you for pointing out the compounding risks, like other risks, socioeconomic conditions, food security, housing conditions. Everything has a compounding impact and really amplifies the impact of extreme risk. It's really very clearly came out of your research. Thank you again. So I would like to move to Patience Chadambuka from Zimbabwe. Patience, the floor is yours. Patience, can you unmute yourself? Yes.
Okay. All right. Thank you, Aina, and everyone. I'm not so sure if you can hear me now.
Yes, we can hear you, but we can't see you. If you prefer camera on, you can turn it on or continue.
Okay. It's actually on. I'm not so sure what's going on.
It's okay. You can continue.
It's okay if you can allow me to start. Thank you. So our research topic was Bedbridge residents' perceptions of extreme heat, and my name is Dr. Patience Chadambuka from the Midland State University in Zimbabwe, Southern Africa. Can you move to the next slide? Yes, and our research team was comprised of myself, Patience Chadambuka from the Midland State University Community Studies Department, and we also have Dr. Sandra Batasara from the University of Zimbabwe, and Mr. Talent Moyo from the Midland State University as well. So broadly, our study is sought to All right, it was aimed at capturing the perceptions as well as coping strategies of Bedbridge residents on extreme heat. Can you go to the next slide? Yeah, so our study was carried out in both Bedbridge rural and urban wards, where we were focusing on the two settings to find if there are any similarities or differences in terms of perceptions and coping strategies between rural residents and urbanites. So like I've also pointed out, this study was carried out in Beitbridge, which is a border town between South Africa and Zimbabwe. And the town is mainly composed of cross-border related livelihoods, and it is also a multicultural setting, that is Beitbridge urban, whilst in the rural areas, the people that you find there are the indigenous Venda people. And the district itself has a population of 94,000, comprising of 44,000 men and 49,642 women or female. It is also one of Zimbabwe's hottest borderlands, and it is characterized by flash floods in November, which are also caused by the extreme temperatures. So the temperature range for Beitbridge has also increased as a result of climate change, where it has risen from 1.4 degrees in the 1950s to 3.3 degrees in 2012. And in the same period, the mean temperature also rose from 25 to 27.5 degrees. So the average daily maximum temperatures vary from 30 to 34 degrees, was from summer. That is from summer, and in winter it also varies from 22 to 26 degrees Celsius. Climate change as well has resulted in changes in weather patterns, where we now have the month of February becoming colder and not the traditional June and July spell. So our research was it involved a mixed method approach, where we distributed
We can't hear you, Patience. Did we lose you? Maybe there is a connection problem. Hopefully it will go away. It looks like you are muted, Patience.
Yes.
Okay, you're back. Okay.
Sorry, I'd lost network. Can we move to the next slide? So there were not much changes in terms of what we had planned, but of course there were a few demographic issues that we had to change. For example, we had targeted participants based on age groups, but we found it a bit difficult to have a set of focus group discussions comprising of particular age groups. So we ended up mixing, but as well making sure that we had we had representatives from the age cohorts that we had targeted in the first place. And we also managed to reach out to the number of participants that we had initially planned to. Of course, because Beitbridge is a border town that is based on cross-border livelihoods, you'd find that a lot of people are always busy, especially during the day. So as a result, we had to conduct some of the research after hours, so that we could have at least the desired amount of participants. And the hot weather itself at times was also a challenge, because you notice that we had our field work in August and also October, when temperatures really rise. So at the end of the day, the hot weather became it became a challenge. But of course, we had to make sure that we conduct our interviews either in the morning or at least late afternoon or in the evening. Next slide, please. So our findings, you would find that there were some similarities and differences in terms of what we found both in the rural and urban areas. But one thing that was recurrent was that extreme heat has been considered as being normal by leaders, yet its effects are felt. And this was actually confirmed by both the key informant interviews and our ordinary participants. The idea is that people actually think that it's normal for Bedbridge to be hot, and so people are not supposed to be worried. But as our research actually revealed, a lot of people find it difficult to cope with extreme heat, and they think that this is something that needs to be addressed. And then we also realized that climate change is real, and that temperatures really have been rising. So through our key informant interview with the meteorological department, we actually noted that Bedbridge recorded its highest ever temperature on the 3rd of November in 2021, which was 44.8 degrees Celsius, surpassing the 44.4 degrees Celsius, which the office could not even ascertain on the dates, because it was just a small piece of a newspaper article which was in the office, but they couldn't even ascertain on the dates. They were actually thinking that maybe something that happened maybe 40 or so years ago. So this is the, you can see that climate change is real, and that extreme heat is actually real as well. The causes of extreme heat that we identified, especially from the key informant from the meteorological department, is that Bedbridge is a low-lying area, and as a result, it is susceptible to high temperatures. And in the urban areas as well, the issue of urbanization and the urban island effect is also taking its toll, because the town has been rapidly urbanizing, especially in the past 10 years. And as well, in the rural areas, we also found that deforestation is also taking a toll on the climate, because people chop down trees for firewood, because this is the main source of energy. And of course, participants
Probably patients having another maybe internet connection problem. I think she'll be back soon. Yes.
lost you for a while. Okay, I'm now back. We noticed that there's a overcrowding, especially in the urban areas, because of high rentals and the general high cost of living. And then, of course, livelihoods, both in the urban and rural areas, also expose participants to extreme heat. We have agriculture-based livelihoods in the rural areas, as well as informal trading and informal sector-based livelihoods in the urban areas, especially vending and sporadic facilitation of cross-border trading, out of other related livelihoods, which actually expose a lot of participants to extreme heat. And in terms of impact, participants also pointed out that extreme heat had a toll on their health, where you would find that a lot of people, especially women, especially the young ones, had difficulties with urinating during the hot season. And then we also found that extreme heat has also huge impacts on people's livelihoods, water sources, energy sources, and social life. Then we also find that different groups also developed different eclectic coping mechanisms to circumvent the impacts of extreme heat, but these were actually as a result of the different social and economic inequalities, where you'd find that those that live in high income areas had better coping mechanisms based on swimming, based on taking a lot of beverages, using air conditioners, use of fans, owning fridges and so forth. But for those in the rural areas and the low income urban areas, it was difficult because of economic challenges. So you'd find that a lot of them also mainly depended on drinking water, but water itself is actually a challenge because of poor service delivery from the local authorities. Then, of course, some people also succumbed to, but also depended on bathing several times, but of course the availability of water was a challenge. And then we also noticed that there's no significant attention that is paid on extreme heat at institutional level, and participants also thought that they could protect themselves by using and also raise awareness through the use of social media, text messages, the internet, television and radio shows. That is for those that were in the urban areas, but for those that were in the rural areas, they actually thought that there is need for official communication through community leaders. Well, of course, social media text messages could also be used. Let's go to the next slide. Then on recommendations, we noticed that there is need for information dissemination and awareness on extreme heat, and there's also need for sensitization and collective efforts by the government departments and other stakeholders, including non-governmental organizations and the private sectors, as well as the concerned communities. We also noticed that there is need to help communities to deal with extreme heat and, of course, to enhance their livelihoods, since they are much affected by extreme heat in their day-to-day activities. Thank you. I think that's it.
Thank you so much, Patience. This is also a very interesting research, looking at different contexts, urban and rural, and finding very interesting similarities or linkages. And I see that your findings are very much in line with the others, that people pretty much resort to self-protective measures, the lack of institutional awareness and dissemination of information or protective measures are largely lacking in many places. Thank you again. Okay, so we have one last presentation from our team from Guatemala, but I will ask you to share your screen, please. Gabriel or Edgar, first introduce yourself, and you will need to share your screens, please. Go ahead.
Don't worry.
Come on. Good morning. Thank you very much for having us with you this morning. This is our friend Gabriel and myself, Edgar Lopez. A pleasure to be with you. Please. All right. Our study is it's precisely about the perception of two
Gabriel,
communities.
can you put your presentation in a slideshow mode so that we can fully see it? If you can go to slideshow. Yes, perfect. Thank you.
Is it already?
Yes, perfect.
Is it okay? Okay, good. All right. Well, our work was related actually to the perception of two communities in a location in Guatemala. The location is called Zacapa. So the purpose actually of this research examines the relationships in between extreme heat and migration, displacement, human mobility, using a mixed quantitative and qualitative analysis of the socio-demographics, conditions, labor practices, perceptions, and impact of the phenomenon of extreme heat. The two communities are called Zacapa and Estanzuela. We conducted this interdisciplinary international research team with local people of these two communities being involved. And about the context on the quality front, we conducted a semi-structured interviews in these two communities. And the semi-structured interviews had the following sections. First, introductory questions. Second, perceived socio-ecological risks. Third, perceptions and experiences of extreme heat. Number 4, perceptions of adaptation. And number 5, perceptions and needs of organizations and NGOs, challenges, faces in terms of access to resources and information. Then perceptions of organizational response to farm workers during heat waves. And finally, perceptions of ways to improve organizational response to future crises and demographics. Well, this is the map of Guatemala. In the green part, you're able to see Zacapa, the place in which the study was conducted. And up to the right is Zacapa, in which we are actually pointing out the two places in which we did conducted the study. We conducted 2 in-depth trainings with leadership from faculty, and we collected 25 interviews in each place with diverse members of the community.
Sorry,
to make a
Gabriel,
total.
sorry to cut you off, but can you maybe move to the findings more without giving too much detail? Because we only have 10 minutes left, and I would like to get some questions from the audience.
Very well. Well, here we have the qualitative results. First, people were experiencing extreme heat, water scarcity, deforestation, and economic challenges. Adaptations by reforestation, wearing long sleeve shirts and hats, using fun inside their homes, and visiting cooler places. Used cell phones, social media, wanted organizations to help with finding jobs and support local health centers. Heat plots show that extreme heat days are increasing. People are adapting in numerous diverse ways, but still need help. Had varied experiences of organizational response. Rural areas, less support. Urban areas do have more help. Need additional support from organizations in job readiness and in public health. Data shows how public health responses intersect with climate changes and economic response. Now, communicating strategies via internet, radio, and the telephone may be part of the data-driven recommendations for supporting these communities during heat waves. Results indicate that partnering with local municipalities, especially, and interviewers regarded them positively, could be an effective mode of transmitting information and support to local communities. In addition to partnering with municipalities, respondents call for their partnering with health centers and working with agriculture and combating deforestation through reforestation efforts. Heat plots and trend tendency analysis indicate the need for government agencies, NGOs, private industry, universities, like in our case, and the scientific community to create mitigation and adaptation programs that might protect the most vulnerable in Zacapa, the children, the elderly, and the rural communities. It is recommended to expand the study of the impact and perception of heat waves to other departments in Guatemala within El Corredor Seco. Well, in this appendix are examples of interviewing results, relating the impact of extreme heat. Regarding people that have to do with agriculture, things have dried up because of global warming. It burns our crops. Things are drying out because of global warming. Cold weather affects the harvest, and the heat helps melons grow. Here in Venezuela, melons grow more because of the heat. Regarding health, we're going to hospitals because of climate change. When the climate change from very hot to cold, people suffer from respiratory problems. Thank you very much for your attention.
Thank you so much. This is a really interesting study, bringing the multi-stakeholder approaches and working with local municipalities is really, really important. Thanks for pointing that out. So we have very few minutes left. I have time. I can stay. I hope some of the audience can stay too. But I would like to open it up for some questions. Could you please maybe add your questions in the chat, and I will be monitoring the chat. But while waiting, I would like to ask our researchers some questions maybe. I can start. So as I mentioned, like almost all of them pointed out that people are actually already experiencing it, uh, the impacts, and they are resorting to self-protective measures. In that sense, how do you see the organizations like Red Cross, Red Crescent, or other local NGOs, community-based organizations? What kind of role they can play in not only helping communities to cope with it, but also trying to make more sustainable, more institutional changes and bridging the communities with the policymakers. I see, Gabriel, you are raising your hand. Maybe you can start, if that's what it means. Okay, go ahead.
Yes.
Thank you very much. Well, we think really in Guatemala that the role of Red Cross is capital. It's a very well-respected institution. We told them about the Red Cross being involved in this study. And people really appreciate that because locally it's very well known and respected. So definitely, I think has a specific role that we can do something together. We can duplicate, triplicate the efforts of getting more information and actually with that, more help to the communities. Thank you.
Thank you. I mean, from our side, we also think we will benefit from your expertise. I mean, this research is all about that. Like, we need evidence. We need to show policy makers and decision makers evidence. Like, this is happening, and this is already measured in the communities. It's not just, oh, it's getting hot. It's always hot here. We encounter this kind of sometimes responses. So this is really, really important. Thanks a lot. Victor, you wanted to add? Go ahead, please.
Yes. So I want to add that with what Red Cross is already doing, I would like to argue they should continue, especially with investing in research funds to be able to understand people's how extreme heat affects their livelihood, especially to even go further to see to what extent does it lead to social inequalities, social risks, and then all of that. And then to move a step further, that is after gathering evidence, all of that, is to move a step further and try to play an advocacy role to engage with the various sectors, the various agencies, like, for example, at the in-country level, you are looking at the planning department, you are looking at the city planners, you are looking at the mayors, all of those people to see how they can be able to design buildings or design environments in such a way that they can be able to provide a lot of opportunities for people to be able to mitigate the effects of heat on them, with regards to looking at urban forestation, trying to ensure that they actually create spaces for people to be able to plant trees there and be able to take care of them, be able to ensure that those trees are there to be able to provide shade, and then create public places that people can be able to get into. Let's say when they are in the sun, they can be able to get into something that they can be able to relax. So that advocacy role is what I think Red Cross can actually move to get into the various governments and engaging them, and even also influence policies at the regards to general policies on how to site your buildings or how to design your buildings and things like that. I think if they're able to do that, they will be able to make a stronger impact.
Thank you so much. These are really encouraging words, and I see that we have quite a lot of colleagues from different Red Cross, Red Crescent national societies. I hope they're taking all these advice to the heart. Maybe PK and Patience, if you would like to say a few words, please go ahead. I don't see them coming up. Okay, Patience is going. Okay, go ahead, Patience.
Okay, just to say thank you so much for this opportunity, for allowing us to be able to conduct this research. We actually learned a lot, and you know, you made it so easy, because one of the things that make it difficult for us to have to conduct such related research is lack of funding. That's the most important, that's the main challenge that we face. And so for availing that that funding, you then enabled us to be able to go into the field to meet the people, and then to come up with a research from grassroots, and also from experts. So it does go a long way in assisting us, besides coming up with the report for the Red Cross as young academics, because we now plan to come up with at least 2 or 3 journal articles from that. And then, of course, this, I think, is also a very important area of research, because I actually got a call
Connection problems. Maybe, okay, we will get back to her. PK, would you like to say something to not just our Red Cross, Red Crescent colleagues, but anybody who would like to do more in this space, more to reduce the impact of heat risks? Any final recommendations from you?
Yes, I do. Yeah, thank you so much for giving me this opportunity to conduct this study, especially in southern India, where most of the workers are outer workers, and they really don't come out with whatever they feel inside their heart, because they're much worried about the supervisors who are taking care of them. And in such case, so this study helped me to bring out what is really within inside their heart, to come out with what they really feel about it. But one thing I would recommend is, thanks for the Red Cross for giving me this opportunity, the funding part to handle this study. One more thing is, we have just done only one perception study, like what they feel. But what I would like to do is, what was impact after this, creating awareness to them. We have already
Yes, very good
clear
question,
what is
actually.
illnesses, and this is what that we should not do. And what about the post awareness part? That is the thing that I wanted to continue to do. That after creating this, after conducting the study, is there any change in that the workers which we have already went and met through? Is there any change? That is the success of the study, I feel. Definitely, I think the Red Cross will continue to provide still more funding to continue to study, like some other to some other part. What is there any changes that is brought into the people's mind or thinking, like this study has actually, according to me, that gives the success of the study, I think so.
Yeah, that's, I mean, I don't know, of course, in your case, in your the research area, but generally, we would like to use this, the results of these research, as I mentioned, to showcase, to use it as an advocacy also to move and to advance action towards extreme heat. Just to give an example, we just started a new project in 4 countries, Honduras, Indonesia, Bangladesh, and Tanzania, and in cities, and we are using your research, preparing policy papers, advocacy papers to move it and to bring in different stakeholders, local governments, municipalities, ministries of health, other NGOs to work with us. So don't worry, we are really using your research, and we would like to continue, of course. Sorry, I see that there is a question I would like to get back in the chat. What support is available for research on heat waves in Gambia? At the moment, this is what we had. So I think I can put in the link. When you go to the link, heat research link, you will see a link to Global Health and Heat Information Network. So please go to that link, and you can also subscribe for their newsletters. And there you could find maybe opportunities for more research, meet and connect with other researchers. And Global Health and Heat Information Network, together with Climate Center as a partner, we did this research together. So I would suggest maybe connect with other researchers and other organizations working in that space. And hopefully we will be able to continue. But at the moment, I don't have any promises of funding, unfortunately. Thank you again. We are already over time. Thanks so much for your time, for presenting and doing the research, of course. And thank you all the participants for being with us today. Please watch because we will have 2 more webinars in the coming months for the rest of the researchers. And have a great day all. Thanks.
All right. Thank you. Thank you so much. Bye-bye.
Thank you.